Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over a treatment approach for left horizontal canal BPPV. So, BPPV is benign paroxysmal positional vertigo. It's a mechanical problem in the inner ear where you've got these calcium carbonate crystals that sit on an otoconia layer in the vestibule, which looks like a vase, and there's three canals connected to it, and those are the anterior, middle, and posterior canal. If those crystals get knocked loose and go into one of the canals, you can get the sense of vertigo. So if you're watching this, you probably have symptoms of vertigo. I am so sorry. Not a pleasant feeling. Kind of gives you that seasickness feeling, and can disorient you. So when you are experiencing BPV, usually the room is spinning. If you are spinning, something else is going on, and you do want to be evaluated from a medical doctor or physical therapist so that you can get the correct diagnosis in order to get the correct approach and the treatment approach. Determining which canal that the calcium carbonate crystals have gone into is key to having the correct treatment in order to reverse the symptoms. And the sooner that you get help, if you're experiencing symptoms of vertigo, the better. And you do end up making yourself sick to feel better. So, unfortunately, the treatment does require to go through unpleasant feelings. But if you're getting the correct diagnosis, you do the correct treatment, the symptoms can subside fairly quickly. So I did have BPPV for the second time this past weekend. The first time it was in my posterior canal. This time I could look up and I was fine. A lot of times when you're lying back or you're looking up, the posterior canal is involved, and that is the main canal that is usually the problem with the BPPV. Now, one of the things is, well, how can your crystals come loose and go into the canal? I find if you do a lot of hard hitting, which I'd been hitting the ground over and over, or if you're out on a boat and you've got a lot of just up and down jolting, or you're around heavy machinery with it's gonna vibrate, those crystals can become loose. If you've had a trauma to your head, sometimes that can knock the crystals loose, or at least that's the idea of how that possibly could occur. So I did notice that when I turned my head to the left, I would become disoriented and feel that seasickness in the room spinning. And I also noticed if I had a little bit of a head tilt down and turn to the left, that I was also getting the symptoms. So first, I want to decide which ear is the problem. And when you have an assessment, a lot of time you're going to have evaluation, and you can use devices to check the beating if you've got nystagmus in your eyes. And for me, I was just going off of my symptoms because I'm not looking at my eyes and can't see what they're doing or what's going on. But those are the symptoms that I had. Was every time I turned to the left or had a little bit of downward tilt into the left or rolled over to the left in bed, I would have the room start to spin. So once we've decided, okay, left ear and horizontal canal, because it's in that plane, I'm going to go through a horizontal canal treatment. So to do that, I'm going to lie on my left side, my affected side. I'm going to turn onto my back, turn onto my right side, go onto my stomach, and then come back up. So I'm going to take those crystals and I'm going to move them through my horizontal canal on my left side. I'm going to demonstrate what this looks like. If it were my right ear, I would do the same thing, except I would do everything directly opposite of what I'm doing. So the left horizontal canal treatment for BPPV, I'll sit on the edge of my bed and I'm going to lie down onto the affected ear. I'm going to go onto my left side, and I'm going to keep my head supported on a pillow because I want to keep my head elevated for this one. And I will stay here from 30 seconds to 1 minute until the symptoms subside. So it takes about 30 seconds to a minute for the calcium carbonate crystals to settle. Once they've settled, I'm going to turn onto my back, and I'm going to again stay here until the symptoms completely subside, and I'm going to hold my head still. Then I'm going to turn onto my right side, and I'll stay here until the symptoms resolve, 30 seconds to a minute. I'm going to keep my chin down, and then I'm going to come onto my elbows, and I'll stay here until the symptoms completely resolve. And then I can go back to my left side, hold here, and then I'll come back to a sitting position. And that's going to be the maneuver that I'll use to move those crystals through my horizontal canal on my left side, and then I will keep my body elevated. I do find that it's helpful. The literature has found that that's not necessarily the case. I didn't sleep sitting up, but I did keep my head up, and that helped me to feel better. So I hope this is of help. And if you're experiencing symptoms of vertigo, please do go get assessed, evaluated, and find out what's going on in order to get the correct treatment approach. And I hope you feel better soon. Again, I hope this was helpful, and have a blessed day. Thank you.